Here are the 12 differences between bradycardia and tachycardia explained in full detail, each written heading by heading for clarity and exam-ready understanding. Number 1. Heart rate. Bradycardia. A condition where the heart rate is less than 60 beats per minute, BPM. This can be normal, e.g. athletes, or abnormal depending on symptoms and underlying causes. Tachycardia. A condition where the heart rate is greater than 100 BPM. It may be a normal response to exercise or stress, or pathological if occurring at rest. Number 2. Origin of the rhythm disturbance. Bradycardia usually arises from reduced SA node firing, sinus node dysfunction, or conduction blocks, AV block. Tachycardia occurs due to increased automaticity, re-entry circuits, or triggered activity in the atria or ventricles. Number 3. Physiological versus pathological occurrence. Bradycardia can be physiological, especially in well-trained athletes with high vagal tone. However, it becomes pathological when cardiac output is affected. Tachycardia, often a physiological response to exercise, fear, pain, or stress. Pathological tachycardias occur without triggers and imply cardiac or systemic disease. Number 4. Symptoms. Bradycardia. Symptoms arise due to decreased blood flow to organs, fatigue, dizziness, lightheadedness, syncopating. Exercise intolerance. Tachycardia symptoms are due to increased oxygen demand and inefficient pumping. Palpitations, chest pain, shortness of breath, anxiety, dizziness, or near syncope. Number 5. Major causes. Bradycardia. Common causes include aging, degeneration of the conduction system, hypothyroidism, medications, beta blockers, calcium channel blockers, digoxin, electrolyte imbalances, hyperkalemia, hypothermia, sick sinus syndrome, tachycardia. Common causes include fever, dehydration, anemia, hyperthyroidism, stress or anxiety, electrolyte disturbances, cardiac arrhythmias, SVT, atrial fibrillation, ventricular tachycardia. Number 6. Effect on cardiac output. Bradycardia. A slow heart rate may fail to maintain adequate cardiac output, leading to poor organ perfusion, especially when the stroke volume cannot compensate. Tachycardia. A very fast rate reduces ventricular filling time, lowering stroke volume and potentially decreasing cardiac output. Extremely high rates can lead to heart failure or shock. Number 7. Blood pressure effects. Bradycardia often leads to hypotension because the slow rate cannot maintain adequate blood flow. Tachycardia may cause hypertension due to sympathetic stimulation or hypotension if the rhythm is unstable or too fast. Number 8. ECG characteristics. Bradycardia ECG shows normal P waves with long intervals, sinus bradycardia, possible AV blocks, first, second, third degree, slow but regular rhythm. Tachycardia ECG shows narrow or wide QRS depending on supraventricular versus ventricular origin, rapid rhythm. Possible P wave abnormalities depending on arrhythmia type. Number 9. Emergency management. Bradycardia, if symptomatic, atropine first line, transcutaneous pacing if unresponsive, dopamine or epinephrine infusion. Tachycardia management depends on stability, vagal maneuvers, beta blockers or calcium channel blockers, antiarrhythmics, synchronized cardioversion for unstable patients. Number 10. Severity and complications. Bradycardia complications include syncope, heart failure, sudden cardiac arrest, rare but possible incomplete heart block. Tachycardia complications include myocardial ischemia, heart failure, thromboembolism in atrial fibrillation, ventricular fibrillation, and sudden cardiac death. Number 11. Oxygen demand. Bradycardia reduces oxygen consumption of the heart because of the slower rate. Tachycardia increases myocardial oxygen demand, which may worsen angina or trigger ischemia. 12. Associated medical conditions. Bradycardia, often associated with sick sinus syndrome, myocardial infarction, inferior wall, hypothermia, high vagal tone. Tachycardia, often associated with supraventricular tachycardia, SVT, atrial fibrillation or flutter, ventricular tachycardia, hyperactive thyroid disease. Thank you. Have a wonderful day.